Okay, welcome everybody to our health and nutrition workshop. I am Lucy Zaragoza, the preschool social worker, and today we have our presenters Erin from Bogart Memorial School and Lisa as well from Bixby School. So we'll start off the presentation with our health portion, and Erin, you can take it away. Thank you.
All right. Good evening, everyone. Thank you so much, Lucy. Let's get started. I'm going to cover the health portion of our workshop. A little bit about me. This is my 6th year in district now. I've worked at both Trinity and Bogart Memorial School. I started during the pandemic. So we have come so far since then. It's so nice to be in a different time now, and the kids are great. Prior to coming to Bogota School District, I worked for 18 years in pediatrics in Ridgewood, and I'm a mom of 3 girls, 14, 13, and 10. So when I'm not at Bogart, I am very busy. We're going to start off with health screenings. So I have already sent out a lot of the paperwork requesting that you guys want your child screened or you don't want your child screened. And a bunch of you have sent them back already. I do the screenings at Bogart as well as Trinity. And Lisa will be conducting them at Bixby School. I'm actually going to be starting them at Bogart this week, so I'm looking forward to that. During the screenings, I cover the child's height, weight, hearing, and vision check, along with a quick dental check, which isn't getting in there and checking for loose teeth and all that. It's really just a quick, give me a smile, open your mouth, make sure there's nothing obvious right off the bat. If there is anything that the child gets referred for, whether it is hearing or vision, if they fail the hearing test or they fail the vision test, I will be sending home a referral. So keep an eye on that in the month of October in your child's backpack. It will have what their score was, what the vision test picked up. And then I do ask that you follow up with the doctor, pediatrician, eye doctor, audiologist, whatever the case may be, dentist. And you'll see there'll be a portion on the referral that I send home requesting that the doctor reaches out to us after, or they can fill out, they can keep for their reference, we keep for our reference. So it's nothing crazy. The children really like coming in. We hang out in the room for a little bit. They help record each other's height and weight. They have a lot of fun seeing who's bigger, who's taller. So that'll be happening this month. Guidance. So childcare guidance can be different in preschool as it is according to the district. So if you have a child, let's say in Trinity or Bogart, it might be different protocols and guidelines as opposed to a student that you might have in STEAM or in the older grades, K to 5. We do have a few different guidelines and protocols that we follow. We follow very closely with the CDC and the NJDOH. We also have HARP, which is Health Awareness Regional Program. They're a group of nurses based out of Hackensack. They do our immunization audit. They do the flu audit. They're amazing. If I have any questions, we can call them for reference. They're really very helpful. Flu vaccines. So flu vaccines are very important. They are state law required that every preschooler is vaccinated for the flu. Anybody between the age of 6 months and 59 months is required to have their flu vaccine in order to be in preschool, any licensed preschool in the state of New Jersey. Flu shots. If we do not have our flu shot, or I do not have the flu shot by Monday, January 5th, 2026, when we return after winter break, your student will not be able to attend school that day. They will actually not be able to attend until they are vaccinated, and I do have their proof before they can return. Again, it's state law. We have to follow that protocol. It's very important. If your child is turning 5 before December 31st, 2025, they do not require them to have a flu shot. But anybody that will not be 5 by January 1st is required. I recommend honestly that you get them done sooner than later. Once we kind of start to get into flu season, colds, coughs, all those things, it's a lot of doctors and places don't give the vaccine if the child is sick or feeling under the weather. And then it kind of prolongs that. The last few years, it's rushing around in December to get it before winter break. Some places sell out of it and don't have the vaccine available. So I really, really do not want to have to send any students home after winter break um, because they don't have their flu vaccine. So please, 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 the earlier you can get it, the better. Get proof over to us. It really protects the students from getting sick and, passing it along to family or other siblings. Lucy will also be sharing some helpful links, which is going to be on the next slide. This is places that you can visit. They're offering flu vaccines. If your regular pediatrician doesn't have any, or you can't get an appointment with them, you're pressed for time.
Yeah,
So these
and
are
I
a
just
few
wanted,
other.
sorry to interrupt, Erin.
That's okay.
Hopefully we are planning a family wellness fair, which we did last year as well, where the flu vaccine was also given to our families for free by North Hudson, which was a great resource. And hopefully we'll have that again. So please be aware of that flyer. They'll be coming around soon. So if you can't receive your flu vaccine or you don't have insurance, we hope that this event will be great for yourself and our preschoolers. Thank you. I'm sorry to interrupt you, Erin. I just wanted to throw that in there.
Oh, yeah, no, perfect. Thank you, Lucy. Okay, universal health forms and immunizations. So it is important that we do have updated universal health forms and immunizations. This is preschool is the time 3 years old, 4 years old, 5 years old, where a lot of vaccines are given. They're given at 4 years old, they're given at 5 years old. Before they enter kindergarten, they have to have a bunch of vaccines. It is also important for us to have the updated records. The state will actually come in. They do come in. They sometimes come in unannounced. And they will review all our files to make sure that we have the updated universal form, we have the updated immunizations. And again, if your student doesn't have them updated and we don't have them, then we have to send the child home. We really don't want to have to do that. It's really important that we have all the updated health records. Sometimes allergies change and that comes into play. Last year my child didn't have, a nut allergy. Then over the summer, they did develop something. And it's really important that we have, all the most updated information. We do have a 30-day grace period. So you'll see I usually send messages. I know I'm not sure like if Lisa sends them at Bixby, but I do send them for Bogart, reminding you, hey, your student's immunization and health form is up this month. Please make an appointment, visit the doctor, and return the forms when you can. And I do send, some reminders during the month. So we don't have the overlap in not having the paperwork. Communicable diseases. So the following is a list of some of the most common communicable diseases we see in early childhood, preschool, elementary school settings. These are some of the most contagious also. Coxsackie is hand, foot, and mouth disease. This will appear like bumps, blisters, a fever. The child is usually in pain. It's called hand, foot, and mouth disease because that's where the blisters are. Sometimes they have a hard time eating. They're very uncomfortable. And you can imagine after, having your hands in your mouth or, all day licking your fingers and then touching things, it can spread very easily through the classroom. So that is one thing that we're very careful of. We try to keep an eye on, and it's painful for the children. So it's better if they're, resting at home. Pink eye, RSV is upper respiratory. Sometimes this happens even after just having a common cold. This is more like lungs. Sometimes it's accompanied by wheezing, a fever, reactive airway, coughing. A lot of times that can happen after a cold also comes as a secondary illness. Sometimes it even turns into pneumonia. We had some of that last year. Flu and strep. So we try to keep an eye out for these things. These are just a few, as you know. All of these symptoms can also mimic COVID, which, I know is like a common day cold now, but we still monitor for those kind of symptoms too. It can make things confusing and difficult to diagnose what exactly is what. The only other one I didn't put on here, it's not really communicable, but I wanted to talk about it, is rashes. So rashes are very hard to diagnose if it's a bug bite or just, eczema, or it's common for the child to have. But there are some rashes that, are more serious, like measles has made a comeback. So we keep an eye out for that. Rashes, we're very careful. We usually prefer, if we send the child home with a rash that we're not sure what it is, we ask that they do see their doctor and that they bring in a doctor's note clearing them and just saying, it's not contagious. The student may be there. And the same for fevers and vomiting, diarrhea, which brings me to the next slide. So fevers, vomiting, diarrhea. Those three particular require the student to be home from school. They need to be symptom-free, fever-free for at least 24 hours without medication before returning to school. So if your child gets sent home with diarrhea on Monday, they automatically cannot come to school on Tuesday. The next time would be on Wednesday. Same with the fever, same with vomiting. It's important to give them the time to rest. Make sure that it wasn't just something that they ate. If it is an illness, they're not comfortable with stomach pain and having diarrhea or vomiting at school. They would rather be home where they're comfortable resting with, their parents, their guardians. We also ask that they're able to participate in the daily activities. So if they're homesick over the weekend, Monday comes around, they weren't really great over the weekend, they're still not feeling good. We ask that they can fully participate and they feel good enough to do that. That includes gym and eating and going outside if necessary. We do continue to go outside as long as the feel like temperature is 32 degrees and above. So please, I know we've had 80 degrees and it's been beautiful, but the fall is coming and the winter is coming, and the students will continue to be outside for a lot of that, as long as the weather does allow. So please make sure the students are dressed according to the weather and according to be able to play outside. Choking hazards, we ask that you please cut grapes in half. Popcorn is a choking hazard. Hot dogs need to be cut. Anything round that doesn't dissolve quickly. We've had a few with whole grapes being brought in. If we can just cut that stuff at school would be great. Once we open the lunch boxes, the children are hungry by then. They're diving in, and before we get to check and make sure that it's okay, we don't want anybody choking. So please beware of the popcorn. Hot dogs, you can still send in all those things, but we do ask that they be cut, at least in half. Medications. So we are able to administer medications, prescription ones and over the counter. We do ask, there is a significant amount of paperwork that we require that is provided by the doctor's office, as well as a form that the parents sign. So if medication is needed to be administered, we do send forms home. So please don't say, oh, my child might be sick and I'm sending in Tylenol today. We find it in the backpack. I'm so sorry, but we won't be able to administer that way. We do send home paperwork. Doctors, we need their written order, original prescription. There's a parent order. The medication must come in labeled with the child's name and prescription in the original packaging. We also ask that the first dose of any medication must be administered at home. We will not give the first dose of any medicine. This is so the parent can monitor for any allergic reactions or any type of reaction that the student is having if it's the first time they're ever having this medication. As far as EpiPens, we do keep EpiPens on file. Again, doctor's orders, parent orders, original box, prescription labeled with the student's names. There is actually a whole separate allergy action plan that also accompanies this. But again, we do keep them on file for anybody with food allergies. We don't send the EpiPens back and forth, so we do ask that we keep them always at school. They're always with the child. The teachers have backpacks that I'll restock for them, emergency kits, and the EpiPen is in there. So when your child goes out on the playground, their EpiPen is with them. When your child goes on a field trip, the EpiPen is with them. And then I would be the one to get there and administer it, but at least we're not digging around looking, trying to find EpiPens. It's always with your child. At the end of the school year, we ask that any medications that we have, that they are picked up. We do have a form that you sign saying that you did pick it up. We return the medicine and you guys take the medicine home for the summer. If they're staying for summer camp, we can keep the medicine on us for camp, but otherwise all the medications go home for the summer. And then come September, we do ask that all the paperwork is present for that continuing school year. Flu and illness season. So we are approaching, even though it doesn't feel like it, flu season. Flu season typically runs from October through March. Last year, we did see some flu linger into the month of April, which is unusual, but we did have some cases. During this time, we try to take some extra precautions at school with our staff and our students so we can try to keep everybody as healthy as possible. Hand washing is a quick and easy way to reduce the spread of germs. The children are washing their hands all day before we eat, after we eat, before toileting, after toileting. We also ask that the students talk to the students about proper toileting. We have some that say, yes, we can do it, but then they really have a hard time. So we don't mind helping. We're there to help. But making sure hand washing afterwards is a big key. We ask that your students also stay home when sick. Please keep us posted of any illnesses or any symptoms that they are experiencing. If they're going to be absent a day, we do ask that you call the school, send a message on Brightwheel, whatever is easier for you, just letting us know, calling the student out, why they're absent, and how they're feeling and if they are sick or not. This way we can monitor, the other children in the classroom and make sure we, don't spread to the whole class. Wash and clean their bedding. So bedding comes home every Friday from nap time. We do ask that it is washed and cleaned fresh for Monday when it comes back. If they are sick during the week and we send them home sick with anything, I usually do send home the bedding also, even if they're going to be back in a day or two, or they go send home on Monday, but they'll be back on Thursday. We send the bedding just in case, because any germs or anything like that, we try to not prolong anybody from being sick or staying sick. So we do ask if that comes home, please wash it and send it back. Everybody is actually really, really good about that. So thank you all so much for doing that. Okay, chronic absenteeism. So as much as your child is sick and we want them to be home so they can get better, we also do want everybody to be aware that missing 18 days of school is considered chronic absenteeism. So understand if your child is sick, you provide a doctor's note, that's okay. It's traveling, and if you have any travel plans, we try to ask if you travel during winter break, spring break. I know that's not always possible. And if that's the case, we also just request a letter. So submit a letter ahead of time that will be approved by the district, stating your child's name and the dates that they will be traveling from. So it helps us keep record too. We do encourage them to be at school every day. Once they are feeling better, please have them in school. We really want all our students to gain all the benefits of the program. And one of the ways to do that is to be present and in person every day. There are many ways to communicate. Again, your child being absent, call the school, send an email. The fastest way is usually through Brightwheel. If you use the app in the morning, you can even send it at night. Anytime, your child wakes up at 4 a.m., shoot us a message. If by 9 o'clock they are not in, I usually send a message asking, hey, just checking in on so-and-so and following up. But you can send the message anytime. just please, we do ask that you keep that 18 days in mind, because anything over 18 days, like I said, is considered chronic. And research has shows that students who are chronically absent in preschool, kindergarten, first grade, there's repercussions. You know, they're much less likely to read at grade level by third grade. They're making, you know, they're not keeping up with the other students, and they seem, you know, they fall behind. So please, if your child is feeling well, we love to have them every single day. Some resources. This is the website for the NJ Department of Health, DOH. This is their guidelines. This is what we reference to, you know, if with the fever and the vomiting and the 24 hours, you know, this is where we get that guidance from. And the bottom, some flu basics, helpful tips, some healthy habits to prevent the spreads of colds and flu, hand washing materials. The kids at school wash their hands. They sing a song. They love to do that. You know, maybe you'll see them doing it at home. It's something that you can do with them at home and sing while you wash hands. If you have any questions or are not sure if your child should stay home for the day, or you know, they're having certain symptoms and you don't know if they should come in or not come in or watch them, please feel free to reach out to me via Brightwheel. You can email me, call the office. I check my email all the time. I never log out of the Brightwheel app. I check that all the time as well. So any questions, even just, hey, you know, so-and-so is coughing, you think I should keep them home, come in. I'm here to help. Any questions that you have. And as always, thank you, parents, for all your help and understanding and support. I think that's it for me.
Yes.
Yeah,
Thank you, Erin.
you're
Um,
welcome.
just to piggyback off attendance, it is important. I understand they're in preschool and life happens, but they're also a community when it comes to their friends and their teachers. So they are missed when they are absent. So if they're not sick, please try your best to bring them to school. I also forgot to mention towards the end of the presentation, we will have, if you have any questions, we're more than happy to answer them. But if they're personal questions, you could also drop your name on the chat, and then I can personally contact you, or Erin or Lisa with what specific question you did have. So now we have Lisa, who's going to present our healthy eating and nutrition portion. Let me pull her up. Thank you. Thank you, Erin.
Hi, thank you, Erin. Thank you too for all that you said and all that you did. I couldn't have said it better myself. So my name is Lisa Landolato. I am the nurse at Bixby, which is currently preschool through second grade. I believe this is my 5th year with the district. A lot of my previous experience was in schools. I did a lot of work in West New York in preschool and Paramus School District, mostly the older kids. So this is a somewhat new population for me, but nevertheless fun and challenging. So I look forward to this year. And this is sort of a passion of mine as far as getting kids to eat healthier and helping the parents get a little more creative with what they eat and what they send in and their choices. So I'm happy to present this and we can get going. So in general, 3 to 4-year-olds need about 1,200 to 1,400 calories a day. It depends obviously on how big they are, their activity level, how much they weigh. And this is something I think parents worry about a lot, is making sure they get enough food. And that's, of course, always important because kids are picky. But I think equally important is to factor in exactly where they're getting those calories from, what types of calories, making sure they're getting a well-balanced meal. And that's not always easy, especially because a lot of meals are convenient. There's schedules and hectic things happening. So sometimes it's easy to grab something that's not the best choice, but it's the quickest and it's getting food in your child So as much as we can do here to help provide healthy choices for the kids, we offer with Pontonian, provides our food service here and has a pretty well balanced menu. And so I'm sure that you've all heard about the 4 food groups: grains, fruit, vegetables, and protein. Of course, you have dairy. And again, these are, over the years, the size of the portions and the amount from each food group has changed a lot as we discover what children need more of and a little bit less of to keep their activity levels up, to keep their muscles growing. They're able to heal and recover from illness quicker when they're properly nourished. So it's important to get a little bit from all the food groups, as opposed to like all dairy or all bread and carbohydrate things throughout the day, to try and make it as balanced as you can. So the portion sizes are always, it's hard to read packages that are in the supermarket because a lot of times they come as a package and the servings are a little bit, it's hard to decipher how many calories and how all of the nutrients on the back of the package break down. So it would be advantageous to read the labels and really study when you're picking up things in the grocery store to see what the portion sizes are, because sometimes they're not as big or small as you think. And sometimes you're giving the child more than they actually need, and not understanding the way labels are. And again, raw versus cooked, the preparation is very important, and what you add and take out of food as you're preparing it too will add to the caloric value, the density, how much it fills them up, and the nutrition. And this is just a good way to kind of eyeball. If you don't have a measuring cup, not everybody just has them handy all the time, but if you can kind of, like when you're out or even at a picnic or an event where it's hard to tell what's being served, a cup would be the size of a baseball, 3/4 would be a tennis ball, and so forth. So it kind of gives you a way to eyeball what you're giving the child if you don't have a way to properly measure the portion for them. So, this is a very difficult thing. And I myself don't have kids. I have nieces and nephews. So even I, in my best efforts to tell, my sister, when I have them out, I'll give them all good food and this and that. But, then I'm in a hurry and we buzz through McDonald's, or because it's easy and every kid likes fried foods, and there's certain things kids gravitate towards. But there's ways to be able to experiment with kids in terms of introducing new foods, even if they're picky. A lot of things factor into that. Their specific personality, their preferences. Socially, I notice that there's a lot of different foods that are privy to different. We have a lot of different ethnic backgrounds within the school system. So even I'm learning a lot about what is food that the children eat that I'm not used to. So a lot of that factors into their diet on a daily basis. The family's eating habits as well. Does everybody sit together? Or half the family eating at one time and the other half at a different time? And also controlling. It's one of the first places that kids learn some autonomy. They get to pick what they want and say no when they want, and so they will exercise that push-pull. So it's important not to force something if they don't want it, or something in particular. And it's really important not to, it's easy to say, well, I'll let you have this if you do this. That's certainly, that bartering system is it's not always the best option. So if it happens once in a while, that's one thing, but the children get very used to getting certain foods as rewards. And once they start equating that one thing with the next, it will be hard to get them to switch and jump tracks to being able to eat a more well-rounded diet. And again, it's easy sometimes. It's easier to just fix them what they want. But once they learn that you will accommodate just what they want, sometimes they can use that as a manipulating tool as well. So that's one of those things that you have to try and be aware of, that you're doing just out of convenience, because it can be difficult sometimes. So nutrition science research suggests that it takes kids up to 12 exposures to any given food to put it in a category of foods they like. And exposure doesn't necessarily mean eating it. You know, it could be anything, any way that they experience food. It could be associating it with a cartoon character they see on TV, or seeing a friend eat it, or watching a cousin or someone that they're close to enjoy it, or seeing it being prepared. So the more they see something and become familiar with it, picking it up in the grocery store and explaining what it is to them, the more they might get curious, the better the chances are that they'll get curious about what it is and what it tastes like. To eat the food, looking at the food in a serving dish, listening to a parent talk about it, and of course, all of the things that we sometimes, when we microwave things or we don't actually cook in the kitchen, they don't get to experience the texture or the smell. They don't get to watch it change from one form to another. So it's interesting for them to be able to interact with the food using all their senses. This is something that I think I see more parents. I saw a lot last year doing things that are, you know, putting them in interesting packages, and because there's a lot, especially I notice a preschool, that the kids get like, they have like 6 things that they eat and that's it. And it's, you know, and they're growing, you know, they seem to be flourishing, but that doesn't always mean that nutritionally they're getting what they need. So sometimes making food more visually appealing and more fun for them will make it something that they want to experience or experiment with. And this is also something else. It doesn't take all that much time to have the kids. I mean, I realize they're young for this, but as much as you can include them in the cooking and the mixing and the you know, any type of preparation, or even letting them have their make-believe plates and things that they do alongside while you're doing the grown-up cooking. You know, having them in the kitchen experiencing and understanding food as something that can be fun, and not, you know, because they have to sit and they have to stop playing and eat, and a lot of kids just would rather keep it moving and not sit down and eat. So if they get to experience the food the same way you do, and gardening, seeing where food comes from, understanding gardens, or starting to get them to learn that kind of stuff, will also help them understand where food comes from. It's not from a box or a bag in the freezer. Those things are all helpful as they grow older. And this is, I could go on and on about this. I love, you know, having a plate that's abundant with color. I think it's visually stimulating for them. I mean, my experience is the more colorful the cereal, you got tricks and you got all these things. I mean, I'm not a fan of food dye, but you can see how excited kids get when it's something that looks a little bit more colorful and fun. And then again, vegetables come, as we know, and fruit in a variety of colors. So get them to experiment, you know, key into their favorite colors and play up to that, because you'll never go wrong with any kind of vegetable or fruit when it comes to nutrition. And even if they get stuck on that for a period of time, better that they get stuck on that than stuck on Chips Ahoy and Fritos, you know. And this is another thing too. I mean, sometimes I'm even guilty of when they come in and I ask, I mean, this happens more with the older kids, but, you know, I ask them what they had for breakfast. If they have a stomach ache, what did you eat? And, you know, they tell me Nutella, which I never really knew what that was. And then I found out, and I was very shocked. But, you know, I'm seeing that kids have a variety of things that they will eat. I mean, I'm sure a lot of even grown-ups like to have cold pizza in the morning, or, you know, different things. You know, you don't know what you're in the mood for in the morning. So having something like pizza for breakfast, you know, it does give you the cheese, which is the protein. It gives you the bread, which is the carbs. It's not that far from having a protein and a carb that looks like eggs and toast in the morning. So maybe it's something you can get into them it looks different than the traditional food we would have, but it's still putting something better than a bowl of sugary sweet cereal, so be creative in that way. If you do have to substitute, and sometimes they have fun kind of picking that out. So this was interesting. I like this slide, that it shows different ways to serve. It kind of, again, it messes with their uh, wanting to choose and select certain things. So you're not saying either this or that, but they have a whole selection, and that's how they learn what they like, and you see what they go for. So giving them so many choices and letting them, graze throughout the day. If you leave it on the table or something, again, I realize this is a younger population, the preschool, but as they learn it, or as they see you graze in something like this, that's where they learn the steps that will take them forward through their school life and, as they grow older. And so, yeah, chicken is a big thing here in the school. The chicken nuggets, kids have their favorites. And, again, the menu is pretty diverse throughout the week, but they do get stuck on certain foods. So if you can, change it up or do something a little bit different, like fried foods is very appealing to the kids. So maybe you do veggies. Maybe it's the dipping that they like. Try to discover what it is about the foods that they like or that they seem to get stuck on. It may be not just chicken nuggets. It may be the fact that it's hot, or maybe they like the texture. It can always be something else, not just the food or the taste, but it can be something else that they enjoy. If it's dipping, cut up some veggies, which obviously would be a better choice than chicken nuggets. And see how they take to it. But again, if they only seem to be eating the same thing all the time, it might be something to talk to your pediatrician about, and see if there are other ways that you can get them to sort of veer off into other food choices. And again, these are just options that are providing the main nutrients, proteins and fats. Cheese is always good. Yogurt is always good. We have a lot of kids with lactose intolerance, but I know there are different things that allow for children to have lactose products or dairy products. Lunch meats, less processed is better. So if you look at fresh chicken breasts, things they can roll up and eat, finger foods like that, sometimes they enjoy that. Hummus, which is chickpeas. Again, that's a nice consistency for them to dip things in. And some of the other things mentioned on here, I think they do carrot sticks here. They do a lot of the bananas. They have muffins. They have a good selection of fruits, and they use the little dole cups, which are the cut up peaches. So there's a lot of options for them to have here. And then your cereals, your whole grains, things that are a little less processed, again, and that don't become so binding in the stomach for the kids. So that's kind of my presentation. I have, there's a lot of, it's such a huge subject, nutrition, and so very important, especially because when they come to me, sometimes if they're not feeling well, that's kind of the first thing I start to ask them. Did you eat this morning? What did you eat? Depending on how they feel. And also, I will say, a lot of kids come to school without having eaten first thing in the morning. Some kids have medicines they take in the morning, and a lot of times they come in and they have an empty stomach and medicine in there, and that's not a good mix. So try to be mindful of, especially in the morning, starting them out with something. And certainly, I am here to answer any questions or help out in any way I can. If your children have allergies, I'm aware of those things. We make that, priority when school starts. Let me know, so we have all the proper precautions as far as that goes. And nothing is given to the kids unless I know they have no allergies, and I've checked all that out with the parents. And if they need a snack, I always can have things here for them. So if you have any questions, please let me know. I hope this was informative. And thank you
Yes.
all for coming.
Thank you, Lisa, and thank you, Erin. We did finish a few minutes early, so if any parents have questions, please let us know. And also mentioned you could leave your name in the chat box, and then we can personally reach out if it's something more personal. But we are excited. Our next event is the Family Wellness Fair. Last year, we had a lot of different resources and vendors there. Like I mentioned, the flu vaccine was administered for free, and we had NJ Family Care signing some folks up for insurance. So that would be our next event. Our flyers should be going out soon. Thank you, guys. Our flyers should be going out soon. So thank you so much for joining us. And if you have any questions, we'll be on for a few more minutes. Or if not, like I mentioned, you could leave your name on the chat and we'll personally reach out. Thank you.
Lucy,
Yes.
I would also like to add too, I mean, I know Erin, like when we did the wellness fair previously, we had some handouts for hand washing. We had some toothbrushes and, hand sanitizer, things of that nature. If there's something that the parents would like to see at the wellness fair presented, please let us know so we can get those resources there in time for the presentation,
Yes. Thank you, Lisa. That's a great idea.
If there's something, let us know.
Yes. Yes. Please let us know. You can leave it at the chat box. If you personally see us throughout the school, you can mention it to us and I'll be more than happy to get that resource for us there. Thank you, Lisa. That was a great idea.
Thank you.
Thank you. I'm just reading some input. Thank you, guys. I really appreciate it. I'm glad if you guys want the presentation shared, that is also possible. Thank you, guys.
Maybe we can try to have some healthy snacks there too.
Hey, Lucy, I noticed that you're recording this. Are you sharing this as well or no?
This recording, we usually put it up on our YouTube. And once it's posted on YouTube, I'm more than happy to share the link. Yes.
Okay. Yeah, it's just because my wife wasn't able to join. So.
Of course, of course. So I'll do that as well.
All right.
Thank you. Okay, thank you all for joining us. So I'll be closing out the call, but if you see us around and you have any questions, thank you so much for joining us. And once again, thank you, Lisa and Erin, for today's presentation.
You're welcome. Thank you.
Thank you.
Yeah, you're welcome. Thank you.
Thank you, ladies. So it's just us and Kathleen, and I stopped recording.
Okay.
Just